Hi, I'm Greg Fell, I'm Director of Public Health. The stay-at-home message is back. People must stay at home except for education, work, if that can't be done from home, exercise, recreation, medical reasons, shopping for other food and essentials. But people basically stay at home, and stay at home does mean stay at home, the point of which is to reduce social mixing, because that's about viral spread. Pubs and restaurants will close, and non-essential shops will have to close. There's a range of further, more nuanced restrictions, but those are the main ones. The other thing it's worth bringing to people's attention is the definition of vulnerable. Clinically vulnerable people are vulnerable to more severe illness, and the definition has changed to those who are over 60, not over 70, and particularly those over 60 with one or more long-term conditions, so a lung disease or heart disease or diabetes, for instance. They are vulnerable to more severe illness, but they're not extremely vulnerable. So the recommendation is to over-characterise it, reduce the number of people that you mix with, because mixing with people provides opportunities for a virus to spread. Wash your hands a lot, it makes a real difference. Keep your distance from people, particularly in indoor, enclosed, crowded public spaces, and wear a face covering. Wearing face covering does make a difference. So that's essentially the recommendation for those who are clinically vulnerable. Those who are clinically extremely vulnerable, alternatively known as those that are shielders, we're not yet reinstigating shielding. That may come, but at the moment we're not. And the government will be writing to those that were on the shielding list. And again, the recommendation is more strict, and there's a healthier, heavier emphasis on the staying at home message, which applies to us all now. We're all in a stay at home scenario, but be extra vigilant, because the point is those that were extremely vulnerable, they're extremely vulnerable to a very severe illness that does carry high morbidity, illness rates and mortality rates. So that's a non-trivial thing. But through all of the changes to the guidance and to the rules and the restrictions, the basics for all of us remain. The things that make most difference have remained from the start of this. If you have symptoms, stay at home, get a test, and if the test is positive, you'll be asked to stay at home for a fortnight, and your contacts will be contacted and asked to stay at home. That's the single most important thing that we can all do to reduce the chain of transmission, is to self-isolate. Washing hands, wearing face coverings, keeping distance from people continues to be the thing that makes most difference. So those are the basics, and the individual behaviour of all of us is the thing that will continue to make most difference.